But yeah, go ahead and go to the next slide, please. So we are ready for our panel, everyone. So our panel is called Path to Public Health. Excuse me once again. And then we'll be featuring rising Filipinx professionals within the field. So next slide. I'll be passing it on to our panel moderators, will be Bradley and Stephanie. So please go ahead.
All right. Thank you, CJ. What is up, everyone? Hope you all have a great morning so far. My name is Dr. Bradley Ramos. I work for the Department of Public Health in San Francisco on Ramaytush Ohlone land. I work as a clinical pharmacist in our many primary care clinics across the city. I also happen to organize with Kamille Magante, our keynote speaker, as a part of Kapwa Health Collective. Just want to put that out. She did great today. And yeah, I will be one of the panel moderators today, and I will pass it to my co-Steph.
Good afternoon, everybody. I'm Steph. I'm going to be the other panel moderator along with Dr. Bradley Ramos. I am pre-PA and currently work as a medical assistant, but excited for y'all to hear the insight from our wonderful panelists today. So I'll toss it back to Bradley.
Thank you. All right, so I just want to quickly go over some panel courtesy. As usual, please keep your microphone muted so that we can shift our full attention to the panelists. We will also be monitoring the chat for Q&A. We will do our absolute best to try to get to these questions as they come up. Otherwise, we will have some dedicated time at the end, as well as any questions that we are not fully able to, we will pass them on to the panelists after and give them a chance to reply to them after, and we can send those answers out at a later time. All right, so I am once again incredibly humbled to share this virtual space with you all and the panelists for this year. I think we may have another person. Okay, great. So let's just start off by introducing everyone. I will let them introduce themselves. Please let us know your name, pronouns, any positions that you hold, and any organizations that you are a part of, and a little bit about yourself. Let's start with Adrian.
Hi, everybody. Happy Saturday. My name is Adrian Machis-Wakong. My pronouns are he, him. I am currently a PhD candidate in the Department of Community Health Sciences at the UCLA Billings School of Public Health. A lot of what I do is actually looking at the intersections of structural racism and immigration. I am also part of the Pilipinx-American Community Health organization. A lot of people might have heard of PILCHA. I know that Aaron Manalo-Pager, who was the keynote speaker last year, is part of PILCHA as well. So a lot of the work that I do is really just trying to think about what are the intersections of structural racism and immigration on health, thinking about the ways that we can address anti-Blackness in the Filipinx community, as well as taking an anti-colonial lens from things, and happy to be here.
Thank you, Adrian. We can move on to Bernie. Please introduce yourself.
Hey, y'all. My name is Bernie. I use she, her pronouns. And before I go into like the degrees and all that stuff, I always like to honor that my identity really is as a creator and a healer and a warrior.
Got it.
And a lot of those identities really do frame my work. And yeah, what I love to do for the community and for our people. And so I'm the founder and director of the Freedom Community Clinic out here in Oakland. We're a community healing movement that really centers on whole person healing, that prioritizes Black, Brown, Indigenous, and documented communities. And I just prolifically create. So I also am part of the founding team of the Institute for Healing and Justice in Medicine, which has done a huge movement to end the wrongful use of biological race in clinical algorithms, and also founded the Woke Walk Docs podcast as a way to just talk about my feelings of being in medicine. And so by day, doing all that creating, and also by day, finishing up med school, finally at UCSF School of Medicine, almost done, have decided to not go to residency to fully pursue Freedom Community Clinic, and we can get into that later, but just so happy to be here with y'all, and so excited to be in conversation with these dope people.
Thank you, Bernie. Richard, would you like to introduce yourself to everyone?
Happy to. My name is Richard. My pronouns are he, him, his. I'm currently a graduate student pursuing a master's in public health and epidemiology and biostatistics at the UC Berkeley School of Public Health. I'm also a graduate student researcher at UC Berkeley School of Public Health and also at UCSF. Informally, I have experience in higher education recruitment and retention among students of color with Pilipinx Academic Student Services, otherwise known as PAPHC at Berkeley, and also the Bridges Multicultural Resource Center. And my research as a graduate student researcher really focuses on safety net supports, income support, and the efficacy of safety net programs such as SNAP, WIC, EITC for vulnerable and marginalized families in the United States. I also do a lot of work related to chronic disease policies to make structural inequities less prevalent in our daily lives.
All right, thank you, Richard. And last but not least, Stephanie, please introduce yourself to everyone.
Hi, y'all. Let me just say what an honor it is to be on this amazing panel with all of these amazing individuals. And thank you so much to the team for having me here. My name is Stephanie Romero. I go by she, her, hers. And I am a first year's master entry clinical nursing student at UCLA. I actually got my bachelor's at UC Irvine in public health sciences and a minor in health informatics. And I'm the co-founder of the nonprofit organization, the Headband Project, Strengthen Buttons, I will talk a little bit about later. A majority of my public health experience stems from research in the trauma and surgery department at the UC Irvine Medical Center, as well as the online free clinic in Garden Grove.
All right, so now the audience knows a little bit about our panelists. Let's start with our first question. All right, so the theme of the conference is the new public health. And I think Kamille really started it off with thinking about what that idea means. So what does the new public health mean to you? And I'll start with Adrian.
Thanks so much, Bradley. So, when we think about public health, I think a lot of people, suddenly we have, at least, because of the looming pandemic we have, a lot of people think they know what public health is. And a lot of people think they don't know what public health is. I think when we think about this idea of new public health, I think it's really this idea of both community engagements, about addressing structures, and especially because we talk about these dual pandemics with both COVID-19 and racism, I think the biggest thing that we need to really be addressing in this new idea of public health is the structural factors. So anti-Blackness, racism, colonialism, thinking about the ways that capitalism functions into this. And so thinking about those structural issues, I believe, is really that new path to public health. Because yes, we can do all of these individual interventions. And yes, it's important that we have people who do individual interventions, but we have to work together and we have to mobilize in order to address some of the large looming crises that we face soon.
I love that I'm following. Can you hear me? Yeah. I love that I'm following you, Adrian, because I feel like we be vibing, we're on the same page. But I feel like for me, I realized that, yes, it is about this bigger picture. And I think what the media is not really telling us when they're really concentrating on vaccines and these biomedical interventions is that it's a bigger issue. It's about what is a community, what is causing a lot of these health disparities. And I think a recent shift in my journey in framing what is a new public health is that we cannot simply be addressing health injustices and criticizing the institutions that they're not doing enough. And in summary, we can't only know what we're against, we have to know what we're for. And that is what the new public health is. That is about that we cannot simply be asking these white men and these institutions like, yo, do better. Yo, can you put like anti-racism training? And it's like, I don't think these institutions were never made for our people, so therefore they're not going to respond in the way that we need to. Therefore, we need to see ourselves as the creators of new systems, of new institutions, of healing for our people. And so what has been huge for me is that we cannot, through a medical lens, like Western medicine is just not going to be the dominant system of this next evolution of our people, because it's so focused on risk and disease. And the reality is that Black and brown bodies are not just their diseases. They are more than that. They are their health, they're their healing. We have ancestors that have been on this for so long. And so for me, it's about how do we see ourselves as the creators of new institutions where we're not begging people to do better, but actually seeing ourselves as powerful to do that for our communities, being creative in doing that. So talk more about that with Freedom Community Clinic, but it's about creating our own healing structures, creating our own institutions that have never before been done. And I believe that that's what our communities have been doing for so long.
Likewise, I love that I'm following Bernard because I couldn't agree more. And for me, the new public health really comes twofold. The first is that it's a reckoning with all the inequities that have been perpetuated and continue to be perpetuated today. It's a reckoning with the discriminatory history, the exclusion of people of color, specifically Black folks, Latinx folks, Filipinx folks, among other the marginalized identities. It's a reckoning with these systems that have structurally discriminated against people of color for literally centuries. And although there has been a thread of maybe here or there particular researchers or particular public health practitioners bringing this to the forefront for quite a while, it really hasn't come into the spotlight. And I think to rectify that, we need to do more and go above and beyond just including marginalized peoples and vulnerable peoples in the conversation. We need to center their voices in the conversation, because if the goal of public health, or rather this new public health, is to really focus on these health inequities, to promote justice, to correct for all the wrongs of the past and create a better and healthier society and world for all of us, you need to recognize that history and really center and bring the people that you aim to serve into the forefront, because who better to tell you about their experience than the people actually living it. They are the primary source of information, and this is their lives that we are just a part of, because we want to provide them the ability and create for them a world where they can really be their most true, authentic selves.
And also kind of building off that point of not being able to build on these broken foundations that we have already lived through with, we see with our families. I've had family members in and out of the hospital consistently with their concerns that doctors are not listening to them. They don't want to get translators all the time. The underutilization of translators in a hospital setting, even with our Spanish speaking populations, Tagalog, for example, they don't have these resources. They have these resources, but we're not using them in our fullest capacity. And a lot of these patients that do come in, when they think of public health, they don't even know what's out there for them. What is community health clinics? Are there even free health clinics for me and for people that are like me? Does my documentation status still matter here? And the fact that they're still worrying about those makes them unable to worry about their own health and the communities around them so that they can promote healing within themselves. And kind of going off of that, the new public health also kind of begs the question of how can we help them believe in a system that has failed them so many times? And how can we put people like us that have experiences like us to be put into these places where we can actually change policies, where the younger generation isn't just being sensitive, that we are the voices and we are the future, and that we can make these pivotal changes, and that the world is going to be so much brighter with us in it, not just because we're adding to the conversation, but because we're making a new table for ourselves to be put into these conversations.
Oh, amazing. I think we're all nailing, what we want as the new public health. I think Bernie wants to step in one more time.
Yeah, and I want to add to that. I feel like the new public health, I think for so long, especially coming from, I imagine a lot of our immigrant families who are like, you gotta go into health sciences, you gotta have all these degrees, you're the first, I'm also the first in my family to become a doctor. And I think the new public health is really not about the degrees. Like, it's not about the degrees. Like, okay, you say intersectionality, okay, you be publishing in JAMA and New England, but like all that shit is paywalled. Or like our communities don't even know what the hell you're talking about with this academic jargon. So I think the new public health and really reaching the people is about knowing that the people are the experts of their lives and have so much wisdom, or others have so much wisdom. So I also just want to honor like the huge healing movement of indigenous healers and lots of ancestral practices that are going to come up in the new public health and the new healing, because it's coming back. We're basically coming back to ourselves and coming back to our land. It's about unlearning a lot of this capitalistic, a lot of this jargon that has told us that we need to have degrees in order to be legit. But I don't really think that's true. It's really about knowing how we can acknowledge the expertise of lived experience itself.
I hear a lot of points interconnecting with each of the four of you, and I love it. But let's go on and move on to the next question, because I do want to know a little bit about how you all got to where you are. So how did you start your public health journey? How did you get involved? And today, what keeps you going in this work? Let's start with Adrian.
Yeah, I mean, I think the biggest thing, and I know a lot of us here in these spaces may have been involved in other like Filipinx spaces in like undergrad, and probably like your first ever experience with Filipinx spaces was probably undergrad. So for me, it was undergrad organizing. I was actually pre-med in college. And it wasn't until being involved in undergrad organizing at UCLA. So I did my undergrad also at UCLA, and I was involved in Samahang Filipino Advancing Community Empowerment, which was really meant to address educational inequities by promoting, students going to higher education. And for me, that's when I really had this idea, not so much about the individual level interventions we can do with people, but some of the structural issues. How when people are born, yes, we are born. Yes, we have these ideals that people are created equal, but that's not how it happens. That people start at different starting points. And to me, the reason why I got involved in public health is addressing those inequities, addressing the fact that people don't have the same access to resources, people don't have the same access to opportunities, that historically we're still reckoning with, the events of the past, with colonialism, with war, with slavery, with everything that's going on. And yet people are historically forgetting about this stuff. It's ridiculous in my head. And yeah, it seems, with everything that's going on right now, it's really easy to get hopeless and to lose hope and to feel sad and to have existential moments. But I think what keeps me going is the fact that, we can think about hope as a discipline. And I forgot who, like rest in power, Bell Hooks. I think Bell Hooks is the one who said hope is the discipline. And thinking about the ways in which I can live. Oh, sorry, Miriam Kaba. My bad, everybody. I always sorry, there's a lot going on. You can tell that my brain is all over the place. But the biggest thing is that keeping hope, right? Keeping hope and keeping joy at the center of your life, knowing that, yes, work is work, but acknowledging how this work can be a stepping stone. And I know that, we have a long way to go. And I know that I may not live to see the fruits of my own labor, but I'll work and continue to have hope towards the future that I imagine it to be, despite what everyone says, despite what everything happens. So that's what keeps me going.
Loving the hope. Loving the hope theme, because I feel like that's also just been a huge fuel for me, especially being in academia and medicine. I'm over this shit. So I feel like for me, my journey in medicine and public health is very personal. And my mom is, love my mom. She's from the Philippines, came here 20 years ago, worked 30 years at the LA County Jail as a cashier. And when I was growing up, she faced a lot of medical trauma and had to actually undergo a hysterectomy without her full consent. That was heartbreaking for me, because ever since then, she basically didn't go to the doctor. And growing up around LA, that's actually kind of the norm for a lot of Black, brown immigrant communities is that we don't go to the doctor. And I'm like, how the fuck are we not gonna go to the doctor if this is the main health institution? And so for me, that was very heartbreaking, but I also saw her heal herself through these beautiful ancestral practices. And she does a lot of her own spiritual counseling and also acupuncture and massage therapy that have helped her in ways that have been incredible. And so for me, that's always been a very personal thing of like, you know, why does my mother not want to go to the doctor? So let me just go into medicine. And basically now in my 4th year, I can understand why. I can actually understand why my mom doesn't want to go to the doctor, why hospital medicine can be such a violent place for Black and brown immigrant individuals. And it honestly just really was a huge ethical crisis for me, because I'm like, how can like I said, I identify as a creator and a healer and a warrior, and why don't I feel those identities so strongly in the medical field? Which is why for me, my hope and my fire has been as a creator. And so for me, I'm always creating and ideating how we can reimagine new institutions. And I have been on committees of diversity and equity inclusion. I've been all the speakers and stuff. And like, I'm done making like lists of recommendations. Like I'm done where like it takes 1 year to put out a report of which you don't even know if it's going to be implemented. Like I've just realized in academia, like this shit is going way too slow and our people need it right now. So for me, that means like, I created something called the Freedom School, which we started to learn more about the healing ways of our ancestors. And then because so many people thought about that, I'm sure a lot of y'all, you can look up on iTunes and Spotify, I created woke walk dogs, because I literally just needed to rant about like all of the things that I feel like our system needs to create towards a healing future. And so y'all can listen to my most recent episode, my last episode on that journey on the bigger journey of all of this. But ultimately, this all goes to what is my labor of love, a beautiful creation that is growing to incredible extent, which is called the Freedom Community Clinic. And started this 2 years ago, literally have been organizing out of car trunks and garages until literally last year. But at this time last year, we were like, yeah, organizing out of taquerias. Okay, it was crazy. And it's basically this labor of love where we realize that whole person healing can be a new framework of the new public health of what our communities can be. And we got really big as we are organized by intergenerational collective of women and gender non-binary people of color, Black, brown, immigrant people of color. So I represent the medicine side, but I also work alongside acupuncturists, energy healers, public health, health educators. And it's so humbling because the way that we all can see healing is so different. And we began to organize these huge community clinics out in Black and immigrant neighborhoods, out in Oakland and the Bay. And just like imagine like after like Black Lives Matter protests, then you see all these Black and brown people in the street, like healing, like with massages and resting spaces. And after that, they go to acupuncture circles, they get their blood pressure checked. It's so beautiful. And what gives me hope is that people are realizing that healing is part of the revolution. Like it's not just about asking these damn institutions to do better. It's about, again, seeing ourselves as worthy of creating that. And so what I have seen through FCC has been amazing. Now we just opened our first brick and mortar out in Oakland. UC Berkeley also just had a huge contract with us. So now we're open at Basic Needs Center. We're about to be at SF State and CSU East Bay. We're being contracted by hospitals and clinics in the Bay Area because they're realizing that this needs to be a bigger conversation, that we can't just put out a DEI report. Like, fuck that. Like, y'all need to embody that. So, yes, that's it, healing.
Thank you, Bernie. And I think I'll start this in that I really struggled with my Filipino identity as a child. Like I always had that feeling that like I never felt Filipino enough. Like I knew I was Filipino, but I didn't really know what that meant. My parents had immigrated from the Philippines. We have our own familial immigration story, but I never really began to reckon with that until college. And in my second semester, I had gotten involved in a student organization at UC Berkeley called Pilipinx-Academic Student Services, otherwise known as PAPHC. And through that, I started volunteering at an after-school program in the South of Market District in San Francisco. This was the Filipino Education Center at Bessie Carmichael School, and it was a Galing Bata program. It was a bilingual after-school program for kids between kindergarten through up to 8th grade, if I remember correctly. And I remember the feeling that I would get whenever I would take the train out into the city and go spend my afternoons every week with these kids who I really saw myself in, was I felt calm. And the kids would tell me about like their dreams, like what they want to do, like where they want to be, like what they want to accomplish, like, but also about their worries. And I really resonated with that. And I remember thinking to myself, what they're telling me as like their kuya is like, they're talking about their dreams and aspirations, but I remember feeling like, I don't think the world that we're in right now can really provide that for them. That there are so many structural barriers to the dreams they want to accomplish and what they want to do that I felt kind of down about it. But then through Filipinx Academic Student Services, this is kind of my adjacent path into public health, because working with people, talking through what they're feeling, being honest about your anxieties, your worries, but also your dreams and aspirations was really the fulfilling thing that really helped ground me into public health. Working with people through all stages of life, I think really kept me going. But what provided me the lens to talk about these things and really look at them in the bigger picture actually came from an unexpected place. At the time, I was pre-med. I was planning to do a double degree in molecular and cell biology and also in geography. And through geography, that's what really taught me to look at things through a dynamic lens of transformation, through patterns, through processes, through structural barriers, through history, and I love that. And then from there, combining all of that together is how I wound up in public health, looking at things as a system, albeit a broken system, but really imbuing the heart of the people in it. Because to focus our work, to focus your drive on people, I think is the most powerful cause and motive that I can have personally. It becomes a lot more traditional from there, public health, undergraduate major. But I always found myself coming back to the heart of the people that I was working with, that no matter how small an interaction, if I can just be honest with not only myself, but also the people that are trusting in me, likewise I trust in them, is how I really find my drive in public health. And that's what keeps me going.
Thank you, Richard. And for me, my journey in public health was very similar. I was pre-med when I was in undergrad, up until maybe like my 3rd or 4th year of undergrad, where I took my first public health course. And it wasn't just about the mitochondria being the powerhouse of the cell. It was about the epidemiology of these areas and how different topography of the area can relate to social determinant health outcomes, and how healthcare expands so much further than just being in the hospital with the patient, that it goes into like the communities, what resources they have or what resources they don't even know that they have. So my public health journey started with just realizing that it's not just about me getting this degree, because that's what I was also taught. I know Bernie had talked about that similarly, like with immigrant families and being a 1st generation college student, it was often, okay, like we brought you here so that you can become like the doctor. And we need to like make us all proud so that your family in the Philippines will be proud of you. And I was caught in a landslide of, am I doing this for myself or in my community, or am I doing this to like make my family happy? But then I started seeking out opportunities to really find why I am actually driven to this. So I reached out to different free clinics, shout out the online free clinic in Garden Grove. And that's when I started to finally realize what it really meant to be in these spaces and talk to these individuals with lived experiences about why they can't get a follow-up appointment in 3 months. Because everyone always says, oh yeah, no, there's resources there. everyone always throws that at the end of lectures that, oh, there's a mental health clinic like over here and there's free health clinics over there. But when we actually look at those spaces, and why is it so hard for us to get a psychiatrist? Why is it so hard for us to get different resources? Because the lack thereof, people are just so happy with the fact that it exists. But when people actually are trying to actively utilize those resources, it becomes so much harder because there's language barriers that aren't even talked about in those spaces. So there's different examples like that that have just frustrated me so much, especially like in the LA community, when all of us have been, because of the pandemic, all of us have been thinking about mental health. And I'm so happy everyone has finally been starting to see the importance of mental health, not only in our communities, but also with nurses and the physicians, the healthcare frontliners that we so idolize. But we don't even know that they're also going through their struggles, and that if we don't have frontline workers that are in their best mental state, how can we rely on them to also be supportive for their patients in the same healing way? And just as like a statistic that I just like found recently, I was reading through the LA Times, and they had mentioned that Compton just has 5 licensed psychologists in the area, while Santa Monica, which only has marginally a slightly smaller population, has 361. And that is just so painful that our communities are still acknowledging the fact that we all know like Compton and Santa Monica, but why we all know the health disparities that exist in those areas, and why are we still ignoring that just because it just exists? But we need to do so much more than that and actually push those policies like forward. And yeah, I can link the article if you want, but I just think that we can be those voices to speak for them that don't even know that they have a voice. I'm sure people in Compton don't even know that there's only 5 versus like somewhere that has 361. That is so staggering. And as a future nurse, I want to be able to provide these resources for my patients and advocate for their holistic well-being.
Wow. Thanks, everyone. I just can sense like the fire in everyone, and because I feel like that last question, what keeps you going, is a very important thing for us to always ask as we continue to move forward. But speaking of moving forward, let's go to the next question. So I think there's a lot of folks here that may be in their earlier stages of their public health journey. So as Pilipinx-American, how has your identity influenced how you navigate your public health journey? And vice versa, how has your public health journey influenced your identity? Let's go ahead and start with Steph for this one.
So I was also mildly detached from my identity as a Filipino American because similar to Richard, my family was very proud of being American because of the different circumstances that they faced in the Philippines. But luckily, the Filipino values of like family and hospitality were just naturally rooted in my life. And I could see all of my family growing in the United States with each passing year. Of course, I had no issues with it. I got to see family, get more pasalubong, and just gain a better sense of like what family really means to me. But what was hidden to me growing up was the hours of petitioning, immigration work, scrambling to apply for Medi-Cal, and trying to explain to them how to fill out these applications when I was only like 13 at the time, trying to understand, okay, your medication's covered. Okay, wait, I don't know if we're allowed to like be able to get like these preventative screenings because I don't know if we can afford that. And I held on to my fond memories growing up, but it made me realize I had to grow up just a little bit faster because I didn't know how to explain the different medical vernaculars that they were being faced with. Me, of course, with very limited Tagalog and Kapampangan knowledge, I had to explain random concepts like, okay, differences between stage 1 to 3 cancer, and what does radiation therapy feel like? And I know Bernie had mentioned this earlier, but that if you are in pain, we can go to the hospital. You don't have to be like this strong, like we idolize resilience so much for a lot of like immigrant families because we have been through so much. And it is a lot more difficult to have my family members that have gone through so much already. And they're like, oh, okay, like, I have like this respiratory issue, but, I've been through like a lot worse. So it's like not evident. So trying to unpack that trauma and make sure that they can actually rely on like these resources, that these resources exist because we can finally use it, is still something that they have to unpack. And that's generations of trauma that we have to keep on trying to like move forward and allow them to believe in a system that is slowly kind of but surely trying to advocate for them because there's so many different people in these resources. So I would have to remind them to get their like checkups and everything. And I could see though that the backbone of them healing was family and community and spirituality, to believe in the hope that they will get better. And that my family was huge. My dad has 11 siblings and my mom has 7. So they were just trying their best to support one another emotionally and mentally and physically at this point. And so my family has really set the standard in my understanding of the patient care experience and how to explain things to people that may not even understand the gravity of the situation, and to instill that hope and continue to hope for them to have a better day, and for the people after us to still believe in that, in those days. So yeah, I'm going to just shout out my family for being my inspiration for this all.
I resonate a lot with you, Stephanie. There's a lot of pride in my family. And with that, there comes a lot of things that we don't talk about. My dad was in the Navy, and he was so proud of having his immigration story, like coming from the Philippines, like being the only person in their very small town to like be able to enlist in the Navy at the time. And then coming here and feeling so proud of wanting to be American and wanting to feel like everything is going perfectly. But over the years, even in the good times, I could always see like things aren't going the way that he wanted. Things aren't going the way that my mom wanted. But we would never talk about that there was a lot of shame in like recognizing that this isn't all that they dreamed about. And especially even before the pandemic, when things got especially hard for my parents and my family, it was always hard to have that conversation with them because they would always try to uplift the good things, see the silver lining in every single thing, every single bad thing that happened, and didn't really want to confront what went wrong and what we can do to make things better, to alleviate some of that hardship, to alleviate some of that pain. And even when it comes to applying to things such as like SNAP for myself during college, or other safety net programs that I was encouraging my parents to access when times were hard, it was so hard to be able to get those resources, even though, and I quote, they exist, that the barriers for people to seek out this assistance in times of need are really prevalent. But shouldn't it be the other way around, that when you need help, help is there, but not only there, but also accessible, that help should be easy to achieve, that assistance should be easy to reach? But the reality of it is, it doesn't work like that. And so working through the pride in my family, having those real conversations with my family members about what it means to actually like be open about your feelings, be open about needing assistance, when that might be the last thing that you want to do, that the last thing you might want to do is ask for help, I think has really informed my public health journey, which really informs like what I do, what I research. How hard is it for people to get access to things like SNAP or WIC? Or how hard is it for people to be able to get all the assistance that they are eligible for and that they need? Because we really want to address the fundamental things that people need right now. And to keep me going through that, I think I really do lean on my family story, because having those hard conversations really motivates me to keep on going in what I do in public health.
Thank you, Richard, for talking about feelings, because I want to direct my answer to this towards the moment when I told my mother I would not be going to residency. And first in family, getting an MD. And it was so emotional. It was very hard for me to tell that to my family, who had been, this is their dream. And like Stephanie was talking about, you need to do this for us, and you need to basically end this generation of trauma. And I realized that was such a painful thing for me, because I thought in that moment I was letting them down. And I thought that because maybe I wasn't strong enough, maybe I wasn't, maybe I wasn't meant out to do and go into the medical field. And I realized in that moment, after a lot of meditation and healing, is that the pressure that we have, especially as children of immigrants, and for a lot of you who are thinking of going into medicine and different medical fields, because you have this pressure of being your ancestors' wildest dreams or your parents' wildest dreams. I would really just challenge all of us to think about who put that burden on us, and who is putting that burden on our parents for us to make our parents' sacrifices worth it. Because in reality, I've been thinking a lot about this whole thing of my ancestors' wildest dreams. And I would think about all of the times in my medical education journey where I could not stand some of the things I had to do in medicine, and I didn't agree with ethically, or the 10 to 12-hour work days. I've been working 7 days this week. I could not bear to do that to my soul. And I think what also made me think bigger about this is when my mother, after 30 years of working in the LA County Jail, she's 69 now, and she said, "Bernie, I can finally live my life and enjoy at 69. And I'm like, oh my gosh, I cannot do that to myself. I cannot, that is my ancestors' wildest dreams, is not for me to go into a system that I personally don't feel is my role at this moment in time, that I feel exhausted, that I've gone through depressive moments and combative and harassment, all that stuff. That's not their wildest dreams for me, regardless of the degree, regardless of the societal status." So I talk about this in my last episode in the podcast, Woke Walk Talks. But I think for me, I will be graduating in May, thank God. But for me, the real thing about going into public health, thinking more about, am I going to do medicine? Am I going to do public health? Where am I going to be? Is really thinking about your role. What makes you feel alive every single day? And for me, when I started working at FCC, I could do that. I could just keep going. I could always talk to community. That was where my heart was, where my fire was. I'm able to get resources in incredible creative ways. People, I notice where I am powerful. I notice where I am loving what I am doing, and I'm paying attention to that. And I think a lot about this whole term of what are my ancestors' wildest dreams. And I think for me is for them to know that I am feeling alive every single day, doing what I'm doing. They want me alive. They don't want me to be another cog in the wheel in a labor system that kept them emotionally enslaved. Am I going to go through that same system? So I'm not saying we don't need doctors. We do need doctors, but know your role, know where your aliveness is, because I think that's really where our ancestors are. And that's really our parents and that's where our lineage's truest joy is our aliveness. And where does that come out for you?
Y'all making me feel so emotional. Thanks, Bernie. I just power to you, Bernie, power to you, Richard, power to you, Stephanie. And I think, thinking about this question about how does my identity influence me, I think about the idea of storytelling. And I think about who tells our stories. Are we the people who tell our stories, or is it somebody else who knows nothing about our community that tells our stories? And I think about the data, about how there's always this talk about data. We need more data. We need more data on Filipinx people. And I'm like, there is data. You just aren't talking to the right people. And that, in our experiences as like Filipinx folks, there's data on Asians, but I'm like, there's always these perceptions that Asians are healthier, that Asians are this, Asians are that, Asians are blah, blah, and that there's this perception that we're doing better than everyone else. But you know that when we disaggregate the data, you know that when we look deeper into it, some of us are having troubles. And this is not just like Filipinx people, there are like, Chinese people, there are Korean people, Japanese people who are, suffering just as much as we are. But I think it's the question about who are the people who are telling these stories. And so for me, the reason why I am a researcher, the reason why I'm an academic is because I want to be the one to tell my story and give it justice. Like the reason why I study structural racism is I think about the experiences of my family members in the Philippines. I think about the histories of colonialism and how it has created this sense of like, oh my gosh, I have to work, I have to be in the medical field. And I think about the way that history has like messed us up. And it's made us seem that the only pathway to success is money. The only pathway to success for Filipinx folks is the medical field. But yeah, we do need these people, but we also need other people too. We need artists, we need educators, we need people who cook, we need people who do these things, we need people who are organizers. They are all valid. That's why, again, degrees are important in a certain sense, but like, remember who you come from and remember the important part. And it makes me think about like, some stuff that's like coming up. So I always just want to engage with the fact of like our colonial history. And it's that like, there is this amnesia that like just happens. And as we think about it, like, how are we going to be the people to tell our story? Whether we're telling our stories as providers, as physicians, as public health people, as nurses, as teachers, like, how am I telling the story as, a public health researcher, right? I study the things I want to tell because, the stories of immigration are so tied to our stories as Filipinx people. Telling a story of immigration is telling the story of my parents. Telling the story of immigration and citizenship is telling the story of me, about me being a Filipinx-American. And so as I think about like, yeah, I want to tell these stories, but I also want to be part of the abolition of these structures that create these inequities, that create the sadness, that create the trauma that we feel. And so, as I think about like, how am I going to navigate? How am I doing all of this work? It's just that like, if I don't tell my story, if I don't encourage other people to tell their stories, someone else is going to tell our story and they're going to tell it wrong. So that's just where I'm at.
I'm so grateful for you all for being so vulnerable and sharing your stories. And I think like the common theme that everyone's been saying, like stories are so important, and they're valuable and they're valid. I do want to note that we see the questions in the chat, and we are collecting them. Just for time constraints, we may not be able to get to them, but we will absolutely get them to our panelists and then send it out in another avenue for their answers. So please continue to keep the Q&As coming. We have our team looking at it. But I would like to go on to the next question. So we'll skip a little bit forward. So this next question, for this, we've witnessed strongly in the last year the manner in which information is communicated, and it's critical so that it's reached and how it's implemented. So what critiques do you have in regards to how public health information is disseminated or not to the general public? Let's start with Adrian for this one.
Yeah, so I want to add a little nuance as to the importance of degrees in education to this question specifically, because there are a lot of people, especially on Twitter, who think they know a lot about public health, and a lot of it's coming from economists. Now, again, we do need economists. That's really important. I'm sure they're very focused on their numbers and their NFTs and things like that. But I think the biggest thing is that you got to be really careful, like, one, for yourself, and two, about like, what is the key purpose? And for me, and this kind of relates to my critique of like public health in general, is that it's so focused on the bottom line, and the bottom line being how much money are we making? And, with all these opening ups, with all of these things that are happening, with like all this push to like move back to school, the bottom line isn't the number of lives that we saved. The bottom line is how much money did we make? And to me, that's the issue, is that so many people are trying to spin these stories in the media of like, oh man, we need to open up to save the economy, but no, you can't have an economy if you have a lot of dead people. Like, and that's sad that we're so enthralled with money than we are with the economy, or that we are with people, because you can make all the money you have, but once once you're done, you're gone. You don't get to see that money anymore. So for me, my critique about how public information is disseminated, I think, again, it's important that we have experts. It's important that we listen to experts, and then we're critical, but we look into the sources. And yes, I know that I've had these struggles with my cousins about them posting this information from this guy who's sitting in like his basement, who's talking about the numbers for deaths. And it is such a tough conversation. But honestly, at this point, like the only person you need to be taken care of for your mental well-being is yourself, right? There are times to engage, there are times to be gentle, there are times to push, but with respect to public health information, there's a lot of bad information out there. And you need to think about like, who's it coming from? What's the source? And ultimately, what is the purpose of this information? And who are we really helping with this information? Yeah, it's confusing, but I have I can rant on forever, but I'll go ahead and pass it on.
Yes, don't engage with your tito at the Christmas dinner table, because that will just be a long conversation that you don't want to have. And that's interesting because piggybacking on that, I also want to say I'd be ranting on this all the time, but I just hate how in public health, the only formal ways of dissemination are through these paywall journals, through these conferences that cost hella to be part of. Like it's a scam. Like it's a scam. It is a scam. Like how are we talking about our communities of who cannot access these conferences, like, and these journals? Like it's so weird to me. And I'm pretty sure this is like all an ego thing. And it's wild because I was like totally on the whole like community, CBPR, community-based participatory research in the very beginning. And I don't know, I still have a bit of disillusion with where is this really all going? Like, is it really just about looking at the journal articles? Because for me, I feel like the most powerful things have been about creative community events and how public health can be disseminated. And so like, I'm just thinking about how like for a lot of our work at the Institute for Healing and Justice in Medicine, I remember learning in our preclinical years in medical school about how Black and Latino people are getting different treatments in high blood pressure medications, in cardiovascular disease. If you want to risk stratify in terms of kidney function, like Black people have a different like algorithm. Like that was crazy to me. And there was no basis on it aside from just this presumption and also history of racism. And so I remember during those years, I was like, you know what? Like, this is going to require a report that goes through the historical significance of this, and then also goes through the clinical aspects, but then goes through the visions forward. And I don't want to edit none of that shit for JAMA. I don't want to edit none of that shit for New England. Like, I want people to learn it as I, as a young medical student, would have learned it. So what do I do in classic Bernie fashion? I was like, you know what? We're going to create our own report. We're going to create our own institute called the Institute for Healing and Justice in Medicine. And we're going to make it the report that it needs to be. So medicine knows, like, this is how we teach it, and this is how we move the vision forward. That took us 2.5 years, and we gathered. And then from those conversations, we realized people were doing a lot of this locally. And once we published the report, which was really us on Microsoft Word doing our thing and like making a pretty layout, we gathered all these local advocacy networks around the country who were doing this work at different hospitals to tear down the use of biological race and clinical algorithms, to say like, this is impossible. We would do teach-ins online and in person. And it got to the point where now they have edited the clinical algorithms for kidney function that affects how people get dialysis and how people get treatment for Black and brown people. Now they have revised those clinical algorithms in over 10 hospital systems around the US. In addition, I think it's at Mass General, at UW, at UCSF. And now these professional societies like the National Kidney Foundation, the American Kidney Association, all that stuff, now they're looking to our institute, which we created out of nothing basically, to advise them through our report on all of this stuff. And now race-based medicine is hella sexy. Anyway, this is just to say that you don't need to ask permission. Like if anything, ask for forgiveness, but usually they're going to push in the way that the pressure is, and you can create that pressure outside of the system. You don't need to ask JAMA and their random ass reviewers, you know? So like you know it, you're learning, you're seeing the problem, like you're the expert, like trust that intuition.
If the goal of public health is for people, then information should be accessible and understandable for people. And bouncing off of what Bernie and Adrian have already said, if we're not distilling all our academic, elitist, power dynamic type of literature into something that actually is actionable for people in their daily, everyday lives, then we're doing them an injustice. By trying to communicate things with the level of nuance for like an academic journal or like your White House briefing or whatever, and not actually talking to people about people, then we're only maintaining that power structure. We're maintaining that like academic elitism of saying, we know what we're talking about because our fancy degrees have allowed us to talk about this. And that's only self-serving. If you're going to do work to communicate public health information for people, it should be for people in a way that everyone can understand. Because if you communicate it in a way that everyone can understand, that the people with the most needs, with the least resources can understand, then you are effectively communicating it for everyone. And I haven't got much more to say on this, but I think that really speaks to the way that we need to continue to work to make public health information more accessible, understandable, and more equitable for everyone.
I think also like so many great points touched upon, especially within we hate the academic journals and conferences are so expensive for what? And like paywalls, like the fact that even my professors have ways to like combat the paywall, like are we really like we were turning in journals for this, for them to like give us a paywall? Like where is that disconnect? But anyways, the critiques I have in which public health has been disseminated as of recently is that a lot of the sensationalization of social media has made it geared towards the individualistic nature of public health. Mask wearing, for the broad example that everyone brings up quite often, that why is mask wearing like an individualistic issue when it's a public health issue? Why are people having so much trouble understanding that it's not about them, like it's about the people around them not like getting the virus? And the fact that so many people are just like, oh, like if I don't have it, then like, but we're trying to protect the community as a whole. And I think emphasizing the community efforts of public health would help us gear us more towards a future where, okay, it's not just about me, it's about the people around me and the community that I'm a part of, so that we can foster a better future in health, and we can have these resources available to each other so that we can ensure that everyone knows that this clinic is available if you want mental health assistance, this place is available. And another issue that I have as of recently, I listened to the 2021 Academy Policy Conference, and Dr. Mary Oneha spoke about disaggregating race and ethnicity data. I saw someone write in the chat that the fact that the government institutions validate our community with quantitative data irks me, because she works in a nonprofit space and their nonprofit can't afford a researcher, and some of true data from the community members are lost. Shout out to whoever wrote that in the chat. Because even when we think of like nonprofit work, even like nonprofits are, there's like some sort of like profit is like what? Like why are we even saying nonprofit if like, and that's the, when I got into like nonprofit work, I created the headband project for the mental health of nurses and healthcare frontliners. But as I was trying to go into the world of nonprofits, I now realize why the nonprofit world is just a bunch of really rich white men And why are they holding like these fundraiser talks to like just to do more fundraisers? Like what, where is that? And being an undergrad and also just like the only like Filipino like woman in my class of it was the public health policy course, and my professor at the time was telling me that like, oh, this is kind of a, are you sure you want to do like a nonprofit? Like it's kind of a lot. And I was like, yeah, like can you help me? Like, so it's just like believing in yourself and taking that confidence forward that you can be that change. Just because no one has done it before doesn't mean that you can't be the blueprint for others in the future. And I think that is just like so important to kind of like instill in our future generations of healthcare providers, public health professionals, to understand that they have the capacity to retell their story. Because yeah, the CDC or whoever is not going to do it for us.
I think Richard would like to add on, and then Adrian, go ahead and talk after Richard.
Thank you, Stephanie, and thank you, Bradley. There was something in your response, Stephanie, that reminded me of an encounter I had recently, a more topical field. But there is a part of public health that is really focused on engaging community voices, bringing those voices to the center of the conversation. But I think, and this is more of like an open question that I still haven't really wrapped my head around, is that there is a movement among some public health professionals to, and I quote, like validate like community voices in a scientific nature. Like people write books about this, people talk at conferences about the importance of bringing community voices into science. But I think, in my personal opinion, the fact that there's an attempt to validate it already undermines like how powerful those voices are. Like to take community voices and try to continue to bring them into like a scientific elitist structure undermines like the true power that those voices already have. And I haven't completely formulated my thoughts on this, but I think that that power is standalone, that community voices are already as powerful as they can be in communicating what is most pertinent to them. That you needn't have the validation of like a scientific or public health conference structure to know that what people are talking about is real, important, and meaningful.
So I want to add on to some points that everyone has been bringing up, and also a lot of the questions in the chat about how do you communicate this with your titas or titos and all this kind of other stuff. I think the way to communicate this, especially with someone who doesn't have the same political or ideological alignment as you, is trying to see where is the common ground. And I know that's hard. And believe me, it's really hard to try to find like, where is that common ground? But I think that's the way to move forward. Because, you know, as much as we, you know, dream of, you know, better worlds, better experiences, it's really tough. It's really tough to, people are tough to change. People are, some people are resistant to change, and people who haven't had those challenging conversations aren't going to be the people who are going to be most likely to engage with you. I think the anonymity of the internet, especially, you know, through social media, makes it really even tougher. And I know for like people like me, I've stopped using certain social media because it's just toxic. It's really just really toxic to try to communicate with people. But in the question about how do we communicate about these guidelines, I think one, you know, again, the logical approach, one, having the information ready to go in case, you know, people are going to try to counter your information about masks not working, about things, all these things about like, you know, getting vaccinated but still getting COVID, right? For example, I think that's always the sticking point of you know, anti-vaxxer, people who are anti-vax, people who are like anti-mask, is like, oh, I can still get COVID anyway. But I think it's one, like there needs to be a little sense of education as to like, how do these numbers that people talk about work? What do these numbers actually mean? And I think, you know, one, by, you know, relying on people, one, and this is why it's important to have people like us, these young professionals, people who are understand public health, people who understand the numbers, to explain like, yes, it's a probability. It doesn't necessarily mean it's a yes or no, yeah, coin flip, but it is a sense of trying to understand, trying to communicate this in a way that people will understand. and even in trying to understand like herd immunity, those types of concepts to people. I think that, there's a lot of people who are, if the on media who have MPHs but didn't actually do the training. They probably did that, but but that could be a story for a different time. So I'll stop there.
All right, so I want to move on to our final question. And I think this is going to help really tie the bow on everything and see where we can go next. How have you reimagined public health spaces or hope to do so in the future? Let's start with Stephanie for this one.
Okay, so I dream of the world where like equity is actually like a real thing. But of course that's gonna take a lot more time and effort because we've seen already to the fact that each household gets 4 COVID tests. I have like 10, 20 people at my house at a time. So like it's more than just equality and understanding how to push equity forward, even though we already have fought for so much equality in the past. But what does that really mean? And to constantly search for the voices that get lost in the mix, because it's so easy for us to, especially in academia, to get lost in that. And everyone brought up such great points about how it's always the community members that that's the data. And we get so lost in the idea that, okay, like I need this publication to get into med school. I need to do this to get into med school, but it's like about so much more than that. And to uplift the future generations that also believe that maybe like, or that are scared by academia or are scared that public health is just about profit, because that's what a lot of people unfortunately like leave the profession because of that. Physician suicide rates and nurse suicide rates have gone up in numbers, especially from 2013 to 2017. I think it's about like 30% right now. And where are their voices too? Because even throughout the Headband Project, we saw that it was just exacerbated that no one cares about the healthcare frontliners. We are calling them heroes, but for what? Why are they forced to be resilient in circumstances that we're not even helping them support? We can go on, we can make posters all we want, but what are we actually doing? And what is the government doing? And how can we actually support them in our communities to make sure that they're in their best well-being, so that we can also push that forward on the patients? Because there's also so many different opportunities that indicate that patients who feel supported by their providers have better health outcomes. And being able to go even further into the structural, like who's going to be our future doctors, who's going to be our future like public health policymakers. We just started getting women in the conversation in Congress for public health. So there's like so much more that we can do. And I'm just like so excited because there's so many of us already in here, 86 of us that have this same passion. Just imagine what we can do all together and how we can just keep pushing this forward by creating the sense of community and creating these conferences that make information and public health more accessible to populations that don't even know that public health is an option for them. And yeah, I will go ahead and let my fellow panelists expand.
Thank you, Stephanie. And I think when I think about public health spaces and reimagining them, I really lean on my time in Pilipinx Academic Student Services and the Bridges Multicultural Resource Center, which I argue is a public health space because education is a part of public health. Everything's public health, if I'm being honest. But through there, I got to see the power of community organizing, where students of color, we were able to find our voice, come together, organize, yield demands to like albeit like discriminatory institution, UC Berkeley, not gonna lie there. And we were able to do more for our community than what the administration ever could have done. And we were able to do it better. We were able to lean on each other, the power of peers supporting peers more so than resources flowing from the top down from an administration to a student organization. We were able to support each other by doing things ourselves and in a way that was more culturally competent than what could have ever come from the administration, because we understood each other. we crafted a space for ourselves where we were able to have trust in each other to speak openly and honestly about how we were feeling, the struggles we were facing, what we needed, and what we can do to have those needs met. And where I bring that now into my current role in public health is creating rooms and spaces such as this and contributing to them, where we are able to talk openly and honestly about our own experiences so that others can find solace and solidarity in how others are facing the world. And I think the fact that we're talking about it now is super powerful because we can continue to carry on that conversation into action to be able to know what we can do for ourselves and for our community, not just now, but for the future.
So I'm gonna chime in real quick after Richard, and just, I think the big thing to really emphasize, at least in my opinion, is abolition and mutual aid. I think the abolition movement is really the way to go, and it's abolishing these structures, these typical ways we think about doing things. This focus on profits over people, I believe, is the way to go. I think, how do I reimagine public health? I think it's solidarity with other historically marginalized communities. So yeah, I know this conference is focused on the experiences of Filipinx people and Pilipinx-Americans, but what are we doing to support Black people, to support Indigenous people, to support Pacific Islander people, Latinx people, right? The people who have always been at the margins. And I think Richard was the one who emphasized this, like in an earlier question, is that how are we focusing on the people, centering on those marginalized voices, I think is the important part. So I think, as we move forward, I, want to encourage you all to, one, to keep hope, and two, to support the efforts of folks who are trying to make the world better for us to live in.
And yes to abolition, and yes to creation of new spaces. I feel like that has been a recurrent theme. And for my journey, that has been with the Freedom Community Clinic. Y'all should check us out. Instagram and website, the Institute for Healing and Justice in Medicine, the Woke Walk Docs podcast. Again, like, I had no prior experience, doing podcast stuff. We just did that shit on GarageBand. Like, do what you need to do to bring the healing to the people. Do what you need to do to trust that intuition and create your own freedom spaces, create your own learning spaces, because these institutions are going to catch on because your intuition is correct. Like, what you see is correct and your lived experience is correct. And so just want to name all of those for further conversation. And again, like we're talking about, like, it's not only knowing what you're against, it's not only knowing that we're like anti-racist and that we're anti-white supremacy, because why? Like, because you're still centering the oppressor, you're still centering their imagination, and you cannot live your life centering their oppression. Like, you have the power to create, to heal, to imagine new institutions, and that's exactly what we're all doing. And when we know what we are for and we move towards that, and not only what we're against and centering the oppressor, when we know that, like, we are the creators of this new evolution of humankind for our people, then yeah, we realize how powerful we are in knowing that the public health really lies in our imaginations and our creations for each other.
All right, I want to thank everyone for sharing. We have a little bit of time left, but I'm going to pass it on to Steph, who's going to share a little bit more about where we go from here.
All right, thanks, Bradley. So that was a lot of information and taking a lot of truths, a lot of fire, a lot of gems to remember from this great conversation that we've had. Thank you again to all of our panelists for joining us here today and sharing their insight with us. It's really amazing to see how far y'all have come, and excited to see about where you're going to go from here. So we're not really going to have a formal Q&A. Unfortunately, we're running a little bit low on time, but we do encourage you to be sending those questions to the PAPHC Gmail. We're going to try and figure out another avenue in which we're going to give these questions to the panelists so that they can answer maybe a bit more in depth, provide you all with some resources, but make sure to send it to the Gmail and we will disseminate all of that information out to you when we can. And it looks like Adrian has also dropped his own email in there, which brings me to my point. If any of the panelists want to drop their information, any links, any emails, LinkedIn, so that y'all can connect with them, feel free to do so. We also have our networking spreadsheet that hopefully everyone will be adding into so that the attendees can connect with y'all later. All right, so we did collect the chat questions. Those will also be shared, and we'll pass it now to the great MC, CJ, so that he can direct us to where we're gonna go from here. So thank you, everyone. Hope you enjoyed.
Of course, I want to thank y'all one more time. Y'all really brought the fire for everyone. Because yeah, once we bring the fire, all that's left is to ignite more passions around this conference. So yeah, you could go up to the next slide. So then we're going straight into our workshop